Hi, this is Dr. Epstein. I'm showing an eyebrow transplant. Why don't you come in here? This patient has a rather unusual direction of hair growth. The outer aspect, the tail aspect, has a totally normal direction of growth. However, the mid aspect is a little unusual in that the hairs are growing almost straight up in a vertical direction. Much more commonly is that these hairs, he's got a rather long eyebrow, which is very nice, very masculine look for him. Most commonly, the direction of growth is this part where it grows straight up in a more vertical direction. Then as it moves laterally, it becomes in a more horizontal fashion. And typically these hairs grow superiorly laterally and these hairs grow inferior laterally, but he does not have that. They're all going straight up. And then these do more normalize, so to speak, and grow in a more vertical, horizontal direction. Let me show you what we're doing here. We're making recipient sites. This is a 0.5 millimeter blade, and I'm basically going ahead and I'm making these very delicate, very tiny recipient sites between his existing hairs in just the right direction. You see how long my blade is, so I have complete control of the angulation. You can see how flat I'm making each recipient site. Up here, I'm following the natural direction of hair growth, and here I'm moving more in a vertical direction. And I'm going more and more. I'm continuing to work between his existing hairs and providing some density here. This is less important to focus here than it is over here. And here's where we want to go in the head region of his eyebrows, going ahead and getting the hairs to grow up in a more vertical direction. You can see there. And on the left eyebrow, we're already starting to fill it. You can see what was done there. You can see how the grafts are going in. These are 0.5 millimeter recipient sites again. The grafts are growing are being placed. Now these grafts were obtained by the FUE technique, follicular extraction. So there's no incision. There's no incision at all. The grafts were taken just from the side. You can see these very tiny dots there, and those are going to heal up as essentially undetectable. Really undetectable scars. So basically what we're doing is we're continuing to make these recipient sites one at a time, and then after these recipient sites are made, the grafts are then going to go ahead and be placed into their designated spots. Thank you. This is Dr. Epstein.